To some more stories, the world's first vaccine against malaria will be available in Ghana and 2 other African countries, Kenya and Malawi, from next year. The new vaccine trains the immune system to attack the malaria parasite, which is spread by mosquito bites. The World Health Organization, however, says the drug has the potential to save tens of thousands of lives. Deputy Health Minister Kingsley Jedu made the announcement at the launch of the World Malaria Day earlier on Monday. My colleague Gahana has more in the following report.
Ghana has made significant strides in the fight against malaria from a prevalence rate of 20% in 2009 to 4.4% in 2016. The program seeks to reduce the rate even further by 2020. Thus, the theme for this year's World Malaria Day, End Malaria for Good. Program Manager of the National Malaria Control Program, Dr. Constance Bart-Planch, was excited that the interventions put in place over the years has yielded positive results visible on the African continent.
We've made all this progress. Does it mean it's been smooth sailing? No. There have been challenges and there are still challenges. The challenge is still to do with the resistance and the use of the nets. Even though we've shown and everywhere, the whole world shows that if you use the nets, malaria can really be, you can be prevented from getting malaria. Still, there are people who do not want to use it. We have a pain, and the pain is the attitude on the use of the nets. People bring in the nets, donors, governments, to support the country. If you will not sleep in the net, please give it to somebody who will sleep in it. The other challenge we have is the irrational use of drugs. You think you have malaria, you are buying the medicine. The medicines also, have side effects. Make sure you have malaria. Test, please, before you treat. There are only 2 regions in Ghana now that we can say are truly hyper-endemic. So the question to us all is, are we on the path for pre-elimination and elimination?
Deputy Health Minister Kingsley Jedu announced, as a way of sustaining this achievement, Ghana will join Kenya and Malawi to partake in the WHO-coordinated malaria vaccine implementation program.
I'm happy to announce that another effective method for tackling the disease is about to be rolled out in Ghana. This is the malaria vaccine. Ghana, Kenya, and Malawi, have been selected to take part in WHO-coordinated pilot program that will make the world's first malaria vaccine available in selected areas beginning in 2018. This vaccine, RTSS, has gone through more than 20 years of testing, and Ghana has played a major role in its development. The malaria vaccine pilot program will assess whether the vaccine's protective effect in children 5 months to 17 months old can be scaled up in reducing childhood deaths and its safety in the context of routine use.
For Joy News, my name is Hannah Odame.